and just memory in general.
Like cognitive things. One of the things, and I did some research before I came, is that in talking to people, some people have actually slept at work near piles of books piled high in a conference room, trying to hide their severe sleepiness. They are called drug addicts. They are called you're depressed. What is wrong with you? Why can't you stay awake? And these are actually symptoms of serious daytime sleepiness.
That's right.
But they fight their whole life with it. And so when I heard that, it just made me so sad. So just know out there that that is not normal sleepiness and that there are answers for those kind of sleep problems.
Especially in older patients, they have this notion, well, I'm older, so I ought to be sleepy because Mama was sleepy, Grandpa was sleepy, somebody in my family was sleeping, they got older. And just, especially in older people, just because you're older doesn't mean you should be sleepy.
And I think that's a great thing to know. Also, morning headaches, swelling in the ankles. I didn't know these were things that were warning signs.
Yeah, people who have sleep apnea, a global or all over the head headache or a headache that's just in the back of the head is common early in the morning, and it wears off as the morning goes on. People who have swelling of their ankles and their legs, those are usually people that have really severe apnea, and the reason their legs swell is when they quit breathing in their sleep, the oxygen level gets low in their blood, and they actually get a form of heart failure, and it makes their legs swell.
Oh boy, we're going to talk about that because that's one of the very dangerous things that can come from sleep apnea. Well, also, they lose the motivation for normal lifetime activities like to see their friends or even sexual urges. They're just too tired to do it.
And they don't have the energy.
Normal.
And it's like a vicious cycle. With the breathing problem, generally, the heavier you are, the worse it is.
Right. Generally, not always.
Not always, generally. And people then who have apnea and their sleep is not restful, I don't feel like doing anything. You gain weight, the apnea gets worse, you gain more weight, and it's this vicious cycle.
Right. So also sleepiness can lead to weight gain. And I actually know some people who work at night, and the way they tell themselves they're keeping themselves awake is by eating loads of trashy carbohydrates.
That's right.
Twinkies, donuts, cake, and it just seems to be a natural part of their routine of keeping themselves awake.
Yeah, you're going to end up doing three things to stay awake. You're going to take some sort of stimulant, coffee, chocolate, tea, you're going to eat, or you're going to put yourself in an environment where you're stimulated.
Yeah. And if they could do that, that would probably be the best of all. But yeah, okay. Well, and then the last thing I wanted to mention is depression, because that's cyclical too. Going through a time of not sleeping, long period, and you're sleepy during the day can bring on depression, or if you already have it, it can make it worse. What's the connection between depression and sleep?
Well, in someone who has even normal mood,
right.
If your sleep is disrupted, you're going to test out more depressed. And another, which brings up another point, if you have chronic pain, if you do testing of how bad are you hurting, if your sleep's disrupted, you're going to hurt more. So even in a normal person, disturbed sleep will make you more depressed. If you're, like you said, if you're already depressed, it makes it worse.
Right. I mean, it can really throw you down badly, so we should take that seriously. Well, you mentioned the Epworth Sleepiness Scale as one of the tools that you use in an interview situation to find out what the degree of sleepiness is or what kind of sleep problems. What other things are you looking for in that evaluation?
Sometimes there's a lot of variability from person to person. Some people won't tell me I'm sleepy, but they'll have the other findings like the memory problems, the ability to work with numbers, and this is very common, especially in people who drive. They won't remember things. They have a memory loss, and sometimes when the sleep is really disturbed, you'll actually have what we call micro sleeps, and you'll have a real short sleep that's maybe only 2 or 3 seconds. Remember I tell you about retrograde amnesia? You forget what happened right before you have sleep, and even if it's a little short piece of sleep, they won't remember what happened. They'll say, you know, I'm not remembering things. I don't remember doing this piece of work or that piece of work. So it's not always sleepiness, but it's a thinking thing too.
Exactly. I was watching part of a study, and the person was so proud of themselves because they were able to stay awake for 10 seconds out of 30 seconds. And so my point to them was, well, let's just think about you driving, and I'm walking along the side of the road, 1 Mississippi, 2 Mississippi, 3 Mississippi. By the time your third second's gone, I've been hit and you're crashed. And we both may be dead. So having those micro sleeps is something that sleepy people can sometimes be proud about. Oh yeah, I can keep myself awake and I'm not asleep that long. Yeah, you are. Oh, you're asleep that long.
When I first started doing this, I had a patient who lived out of town and had to commute and had to drive 30 or 40 minutes, and he told me, I asked him, are you sleepy? Do you do this or that? He said no. But he says, all I know is I get in my pickup truck in Memphis, and the next thing I know, I'm getting out of my pickup truck at home. And there was just repetitive microsleeps and waking up. So there can be that severe of amnesia.
Yeah. And so you would at least want to come in and find out, is this okay? Because it's really dangerous. Okay, well now, I love people who say, oh no, I don't have a problem with sleepiness. I really don't know why I feel this way and this tired all the time, because I sleep from like 8 to 10 hours a day. Really. And of course you look at that and you listen to that, and to the normal unmedical mind you're going, yeah, that is a long time. You probably don't have problems during the sleep. What's wrong with that statement on a sleepy person?
That they're still sleepy despite a long time in bed?
Yeah.
Just getting back to the proof in the pudding thing, no matter how long, first thing I ask is, did you get enough time? That's enough time. That's more than enough time.
Yeah.
And you're still feeling sleepy. Which brings up another point. The amount of sleep that's right for one person is not right for the other. Rarely will I see somebody who's a short sleeper. I'll have a lot of people come in, oh, if I get 3 or 4 hours sleep, I'm fine. That is not very, very, very common.
No.
But there are some people who 3 or 4 hours and they are good all day. And there are literally some people who need 10 or 12 hours a day. So the amount that's restful and normal varies from person to person.
Yeah, if you're going through normal sleep stages during that sleep period, which that's exactly the opposite of what we're talking about here. They are arousing all night long and don't realize that they're arousing. There's also this thing that I read about called sleep misperception, where a person thinks they're asleep, but they're awake. And then a person that's, what's the opposite of that?
They think they're awake, but they're asleep.
Exactly. And so that can be a problem, because when you're trying to question them to find out and they're just sure they're sleeping, you really do have to have other ways of listening to that conversation to find out what kind of sleep they're getting and whether or not they're sleeping.
Yeah, the most common thing with sleep state misperception is the person who says, I'm not sleeping, and they are, because you don't remember sleeping, or I looked at the clock, and I looked at the clock every hour, I can tell you I saw, but they were sleeping in between because you don't remember going to sleep.
Exactly, and that's a funny thing about sleep, and that's why it's good to have a medical input, because there are things you just can't know. It's also good reason to check out a medical sleep study. Okay, so assuming that, some people just assume that the reason why they don't sleep is because of other people. Is that mostly true? Sometimes true? Not very true?
Can be true. It's often true, and usually spouses are so important to me. Number one, for giving me a history to tell me what's happening to the other person. But very often, someone is in bed and can't sleep because of all the racket the other guy is making. So your sleep can be disturbed environmentally by whoever you're sleeping with.
And it can be really serious.
I've had people with hearing loss. I mean, snoring so loud that they lost hearing. I
love that you said that you get information from the spouse. So it's kind of good to bring your spouse with you, your significant other, to the evaluation, because they probably know more about your sleep than you do and can give some useful information.
Absolutely.
I hear people say, my wife says I snore, but I know perfectly well I don't, and then when the study's over, well, there it is. So having a spouse come in and help get that extra data can really help out a lot.